everyone. My name is Aditi Ramamurthi, and today I'll be sharing findings from a mental health education project which I have been involved with at Lehigh University in Bethlehem, Pennsylvania recently. This project was conducted in India and determined how technology can drive both awareness and impact in this crucial area. A little about myself. I'm a rising junior at Central Bucks High School East in Doylestown, Pennsylvania. This is my second year attending the GHLC. In my free time, I am part of my school student leadership team, mock trial team, and I run competitively. Additionally, I have served as the president of the youth board of a South Asian cultural awareness nonprofit, Daisies of Doylestown, for almost 3 years now, and I volunteer at Penn Medicine Hospital in the pediatric unit as well. In 2024, I was lucky enough to present my research on wearable devices conducted at Lehigh University at the Biomedical Engineering Society conference. In the future, I am looking to major in global health and/or public policy with a minor in international affairs and business. Now, one of the key questions of this presentation is, why does mental health matter globally? Well, to answer your question, I will say globally more than 500 million women and girls lack access to proper menstrual education or hygiene tools. This isn't just an inconvenience, it's a public health crisis that reflects deep inequalities in access, education, and dignity. Menstrual stigma that is still very predominant today leads to infections due to unsafe materials, missed education, mental health burdens, and ongoing gender-based exclusion. Menstrual health education is a gateway to achieving multiple sustainable development goals, including good health, quality education, gender equality, and reduced inequalities. Now, why was the focus on India in this study? Well, India has one of the world's largest adolescent female populations and one of the most complex relationships with menstrual health. Only 36% of women use sanitary products, especially in rural or low-income areas. Silence, misinformation, and shame dominate the discourse. And even when digital resources exist, gender digital divides prevent girls from accessing them. This summer, I have been analyzing data collected by my sponsor lab, the Seshadri Lab at Lehigh University, in March 2025. The survey was conducted during the course of pilot menstrual health course conducted at 2 locations in southern India, Healing Touch Rehabilitation Hospital in Coimbatore, Tamil Nadu, and Government Engineering College in Wayanad, Kerala. 83 participants were there, including students and faculty, whom were surveyed before and after the menstrual health education course, combining analog and digital methods. The goal of all of this was to essentially understand how education, especially when powered by technology, could change knowledge, behavior, and cultural attitudes in young adults and use this information to design appropriate education outreach materials and digital platforms, as well as diagnostic devices to enhance maternal and menstrual health in rural populations. Before the course, even university students had significant misconceptions about menstruation. Most couldn't name more than one safe menstrual product. Many males respondents didn't know what caused menstruation at all, even. After just one course, 90% of female students could explain the biology behind it. More students recognized menstrual cups and pain relief tech. Behavioral data also showed the real-world impact of stigma. 66% of participants avoided school, sports, or travel during their period, and some avoided food, kitchens, or even social interaction. The post-course avoidance fell to 30%. The course gave them not only knowledge, but also agency in a deeper sense that their experiences were valid. Behavioral change like this is the heart of global health. It's not just about the treatment, but it is about the empowerment and prevention of it. Technology made the biggest impact in this case. Digital presentations, menstrual cup demos, and even mobile-based quizzes were rated the most effective by students. These tools created a safe, private, and stigma-free learning environment. Over 67% of participants said the most valuable part of the course was learning about health tech, from biomedical devices to sustainable hygiene solutions. This mirrors global health innovations around the world, from SMS-based health alerts in Kenya to telehealth platforms in remote Nepal. The tools work if they're tailored to the local needs of the people. Still, we face social inequities. 40% of participants didn't have a clean private toilet. 74% experienced embarrassment rooted in religious and cultural beliefs. Only 10% of respondents were men, almost all non-students. Nearly 73% of those male respondents said menstruation was a women's issue. These aren't just cultural quirks, they're public health obstacles, and they exist across geographies from rural India to parts of sub-Saharan Africa and Southeast Asia even. But the impact of education is undeniable. After the course, 61% of students said that they would advocate for menstrual health in their communities. More female students felt empowered to speak up, and many requested the course even be open to men. This isn't just an Indian solution. It's a scalable, replicable model for any setting where stigma meets silence. Now, the findings of the project highlight promising digital innovations, some of which are graphical illustrations to educate semi-literate or illiterate young women on menstrual health, gamified modules to teach reproductive health in schools, wearables like the ultrahuman ring to monitor symptoms, and rural Wi-Fi hubs that allow offline learning through tablets or local servers. All of these tools advance digital health equity, especially when localized, affordable, and user-driven. This project reinforces some of the most urgent values in global health today. Education is prevention, technology is a force multiplier, cultural humility is an essential for any intervention. We cannot, as a community and as the human race, reduce maternal mortality, improve education outcomes, or eliminate gender-based violence without addressing maternal health. And we cannot address menstrual health unless we include men, policymakers, engineers, and youth in the conversation. Now, moving forward, the next steps for this study, our team will do some of the following. They will expand the course to North India, where the stigma of menstrual health among rural communities is even higher than in southern India. They will partner with digital health startups to build regionally tailored content. They will push for policy inclusion of menstrual education in schools and universities and conduct follow-up assessments to measure long-term behavior change. Menstrual health is a global issue, not a niche concern. If we addressed it holistically through technology, education, and empathy, we unlock progress for millions of girls and women around the world day by day. Now, all this research and development and survey analysis were conducted within the Lehigh University Biomedical Engineering Department, whose support and mentorship I could not have done without. So I am thankful for them. Thank you. That will be all.